In this episode, Abby and I are joined by Lisa Paladino, a certified nurse midwife, IBCLC, mom, and grandma. Lisa shares her wealth of experience in mother-infant care and her own journey of feeding with her 3 children. We're all on a journey of lifelong learning, and the feeding world is no different. Thank you, Lisa, for sharing your wisdom with us. Enjoy. Hey, Abby.
Hi, Catherine. How are you today?
I'm well. How are you?
Great. I'm so excited for our guest today.
Yeah, you want to introduce her?
Yes. So we have with us Lisa Paladino, and she has over 35 years of experience working with moms and babies. And she was first a nurse, then a certified nurse midwife, and IBCLC lactation consultant, and now an educator in kind of the tongue tie, just feeding space. And we're just so excited for her expertise, but also her feeding journey and journeys with her grandbabies. So we're so excited to have her. Welcome.
Thank you so much for having me, ladies. This is wonderful. I love talking about feeding, as you may know, as I've made it like my life's journey.
Of course. Well, it's a very important, as we've said in other podcasts, it's kind of the first way we connect with our babies. So we're so excited to hear your many years of perspective on it.
Yeah.
And you know what? It just came to me as we were talking before we signed on and reflecting on my experience and where I've come from. My first breastfeeding project at the hospital was a skin to skin research project, because way back, this was in the 90s, late 90s, nobody was doing skin to skin, right? And then we did this thing where we introduced it and it freaked everybody out. But now I know, and this is years later, I'm out of the hospital 10 years already. They're doing it. It's there.
Oh, yeah.
It wasn't as successful until afterwards, but now it's working. And all those policies and groundwork is what I did at the hospital. So the reason why I'm talking about skin to skin is because talking about relationship.
Yes.
It's not even about how you're going to feed your baby, but just having that beginning relationship that we got from breastfeeding. So mothers get that from the breastfeeding movement, but it can be applied no matter how you plan to feed.
Yeah, and working in like NICUs and stuff, we've all done in different ways, and seeing those moms, if you can't breastfeed your baby yet, put them skin to skin.
Yeah.
Like just that contact is like how you bond with your baby, and it helps everyone.
Yeah. So I don't know why that, I don't know where that fits into our planned conversation, but it just came up for me and I thought I'd talk about it.
Just get it. Like my husband will laugh because I was like, when I was pregnant with my first baby, I found out he was going to be premature, and I was like so crazy about skin to skin. Like my whole labor, I was like, just put him skin to skin, please.
Yeah.
Like I want the hour, and it's so important.
And I always start out my lactation consults, if, parents are open to it, with the baby skin to skin as we chat and get to know each other, and just putting the baby skin to skin and telling the mom, take a deep breath with the baby, breathe with the baby. Like there's no hurry, there's no emergency. Just enjoy, smell the baby. I still, even if it's not my baby, I'm like smelling the baby if I'm holding them, that just relaxes you. It brings out that oxytocin, and it just makes, and oxytocin is the hormone of connection and love and survival. So whether or not you're breastfeeding or bottle feeding, either, but for breastfeeding, it's the start of the cascade of everything,
Oh, I love that.
Yeah.
That co-regulation between mom and baby is just so crucial. And you talk about breastfeeding. I'd love to know I know you have children of your own. So I'd love to know a little bit about your own feeding journey, and is that what propelled you into the lactation space, or were you previously there?
Yeah. So I was always very curious about birth and breastfeeding, like since I'm a little kid, but I wasn't really exposed to it. So, you become a nurse, you got to do your perfunctory medical education and work, which I don't know. Now you can go straight to L&D, but when I was a new nurse, I had to do medicine first. Then I went to postpartum. You had to earn your right to go to labor and delivery. And then like I just felt like I found where I belonged. So I was a labor and delivery nurse when I got pregnant the first time. And when my son was born, I realized how little I knew about breastfeeding. And I had been working postpartum, helping, quote unquote, mamas breastfeed, and I had no idea what I was doing. There was a nurse that I worked with who was a breastfeeder, and she was like fantastic. And she taught me how to help the other moms. But other than that, I had no education.
Mhm.
So at that time, now this is really going back, he was born in 1991.
Oh.
We had different things in the nursery. We had bottles of plain water. We had bottles of glucose water. Imagine giving your baby sugar water. And we had bottles of different kinds of formula.
Mhm.
And I was breastfeeding. And
Mhm.
at each feeding, it would be like, eeny, meeny, miny, mo. Oh, this time I'll try this. This time I'll try that, with no rhyme or reason, because nobody knew what we were doing. It was crazy. And you know what? Like, he was a pretty good feeder, but I didn't give him enough impetus to do it. Like, I feel like if I would have just breastfed him from the beginning, he would have been my best breastfeeder.
Uh-huh.
But I didn't know anything.
And
And
he was he born full term? He
full
was
term, very,
just
he
fine.
had a very he had a scary kind of traumatic delivery. He was born vaginally, but he almost wasn't. I pushed for a really long
Mhm.
time. I got
Mhm.
an epidural too early. Like, we could talk about how
The
birthing
birth
affects.
side of thing, right?
Yeah,
Yeah.
yeah. And his first his APGARs was 7 and 8, and
Okay.
that's low out of 10. So if anybody's not birthing people and APGARs that score, it should be a 10, but he came out shocked and not ready to cry. And
Mhm.
they made him go to the NICU. And my first feeding experience was, I met him at the NICU, and I sat in the middle of the NICU, took off my shirt, and just put him skin to skin. And that was without knowing anything. That was just my instinct.
Natural
Like, I
instinct.
wanted to feed him. And like, people are like, you're doing this in the open? Because in those days, nobody, we went into closets to breastfeed back then.
Yeah.
And I was like, I don't care. I want to hold my baby and I want to feed him. And then I was just exhausted, and I went back to my room on the other side of the hospital floor, and so we didn't get the best start, but he did get a start,
Good.
and he breastfed really well, but I did not do what I should have done. And the strange thing happened was, back then pumping wasn't really common, and we only had awful pumps, and nobody really got pumps, and you try to hand pump, and it was just like, I had nobody to support me. And I started saying, well, I'm going back to work, and I was working almost full time as a nurse back then. I'm not going to have time to pump. So I better get him used to bottles. And the more I gave him bottles, the less he wanted me. And then, right, like the week before I went back, got really interesting. He didn't want the bottles. He only wanted me.
He knew.
And that scared me. So I thought, I better wean him. I better
Yeah.
stop feeding him, which
Yeah.
is like counterintuitive to everything I know now, and I was like, I better stop giving him my breast. And like, I'm sad about that, but whatever. Everybody's got their own journey, and
Exactly.
I did the best I could for when I
With the
knew.
knowledge you had at the time, we always.
Yeah, and I always say any breast milk is better than no breast milk, and he got plenty of breast milk, and he's
Yes.
fairly healthy. He makes me crazy, but he's fairly healthy. He's married now, hopefully trying for a baby, him and his wife, my
Oh.
daughter-in-law soon.
Oh.
And yeah, he's fine, right?
Yes.
He did, like, no matter what happens, most people wind up being okay.
Yes, we're resilient people, but it is interesting, like, when you become this expert in the field, then you're like, oh my gosh, if only I knew all that stuff back then.
Yeah, well, I always say that's what motivates me.
Yes.
Right?
Give people
I
that
wish I
education.
knew. I wish I had somebody like me back then,
Like,
somebody with
seriously.
what I know now.
And now you're that person for so many people.
Yeah, I
It's
try.
very-
So then my second was born 2.5 years later, and I had a little bit more education, but not enough, and definitely not enough support. She was smaller than her brother,
Mhm.
and she actually looked like, when I got to the pediatrician the second, the 2 or 3 days after discharge, the pediatrician like really scared me and told me that, I probably shouldn't breastfeed her because she was losing weight and I
Oh,
should stop. And like before that at the hospital, the experience I had, and this is kind of what motivated me to the Skin to Skin project. She was cold because she was really tiny. So my thought was, let me hold her close to me and
mhm.
put a warm blanket over me. Like I had this instinct of let me
You knew
hold
what
my
to do,
baby. And they had to keep her under the warmer and they wouldn't let her out of the nursery. And these were the people I worked with. These
right?
were my friends, right? Like it was crazy. It was
Ah, that's so hard.
yeah, yeah. But and then she was a very challenging breastfeeder and she
Okay.
caused me a lot of pain. And the worst nipple damage I've ever seen was my own left
Yourself.
nipple.
Yeah.
I
Ah,
never thought it would look normal again. It was
Oh,
it was really bad what she did to my now I know, and she still has a
traumatized.
tongue tie.
Yeah.
She still has a tongue tie. And now I know, but I didn't then. So I
Mhm.
had my pediatrician telling me that I was starving my baby. And when I looked back at her record, she had only lost 6%.
Which we
You
don't
know,
even think is a
right.
we don't
I
even
mean,
think
6%
normal.
is normal, right? So, but then I weaned and I
Mm,
weaned as my milk was coming in. It was like
okay.
kind of like the worst experience of
Oh,
my
and you're
life.
so
Having
engorged
all
too.
of a sudden, I have all this, second baby engorgement and
Which
I'm
is really
trying not to use it. There were other details about the birth that I won't get into, but let's just say
yeah. It
I
was a
wasn't comfortable. Let's just
Yeah,
put it that
unpleasant.
way. And we didn't have a good experience together. And it was the beginning, you know, it doesn't affect, I don't think, I mean, breastfeeding affects everything, but it affected us, our relationship, I think. Like
your
we
bond.
had a little bit of a challenge, me and my daughter. Like we
Yeah.
struggled in the beginning with like, even as a toddler, she had like a little bit of an attitude that I couldn't get over. Like, and I bring that back to the struggles because I had weird feelings about what happened. She really wanted to nurse and I
Ah,
refused her. And there's a lot of guilt there. There's a lot of like, I
yeah.
wish I could go back and change that. That was not a good experience for
Yeah.
either of us. And she's been my allergy kid. She's got airway issues now.
Yeah.
She's pregnant with her second and she's got sleep apnea. She's got to sleep upright because her jaw structure is not good. Like all
All
the
the things that
downstream
we know
things.
can
Yeah.
affect did happen. And
Yeah.
so I
So,
appreciate you sharing that because I
yeah.
feel like, we talk about all the things that it can affect and
Mhm.
it just I don't know, it's
Yeah.
interesting to hear
Yeah.
you.
I mean, it's N of one, right? It's like you
Yeah.
can't, it's not a research study. But
Yeah.
if we gather all this information of experiences of people who understand this, it begins to make a lot of sense.
Yes.
And I mean, she's healthy, she's wonderful, she's happy. We are best friends. It's not like,
Yes.
you know what I
It's not
mean?
like
We
it
got
ruins
over
your
it. She
relationship. Yeah,
forgave me.
of course. But I'm
But
sure
yeah,
yeah.
yeah, but there's been some challenges there. And
Yeah.
then my third, so now 8 years goes by
Mhm.
because in the meantime, my sister was diagnosed. This is a little sadness, but she was diagnosed with kidney cancer when she was 6 months pregnant with twins and passed away when they were 6 months
Boy.
old.
Oh my goodness.
So and she had two other babies. So I took care of her kids
Oh my
like
goodness.
in between. So it looks like I have a gap, but I actually
You had
was
a lot of kids
yeah, I had a
joining.
lot of
Yeah.
kids. So 4 years after my sister's twins were born and my own kids were 11 and 8 at the time, I found myself pregnant again. Little bit of a
Wow.
surprise, but we love her anyway. And she was
We're both from
I
big families, so we get it.
yeah, I decided at that point that I was going to do this right. I was going to take all now at this point I had changed my attitudes about birth. I was like annoyed with what we did at the hospital. I was really, really still pissed off at my friends for what they did to me with my second
Yes.
daughter, not letting me hold her. I said, I am going to have a home birth. And my friends were midwives. So I'm going to have a home birth and I'm going to pretend like there's no other way to feed my baby. So
Wow, look at you. Okay.
so my midwife friends were not home birth midwife people. They had only delivered babies in the hospital.
Okay.
And I was like, "You have to do this for me." And they're like, "All right, if you're up for it." My friends, it was so funny when I think about it now because there's plenty of home birth midwives that know
What
what
a
they're doing.
yeah.
We needed extra reassurance because these women had never done this. So I had 3 of my RN friends
Midwife.
from labor and delivery.
Mhm.
We just started hoarding things from the delivery room, equipment. I had oxygen. I had everything you would need in my
Something goes
room
wrong.
looked like a hospital room, right? So
Okay.
we made it like it was crazy. And they were like nuts at the hospital. They were like, "Yeah, she's not gonna," the doctor covering us because you had to have a doctor covering you, right? Was
Okay.
like standing there with a waiting OR room open for when I was gonna crash and come in.
Oh
It was
my
ridiculous. Anyway, fast forward, I had a beautiful
You
birth,
had her at home?
had her at home. She
Amazing.
comes out with a cleft lip,
And you didn't know?
surprise cleft lip.
You didn't
Didn't
know?
know it.
And they're
Sonograms weren't as great
great
as they
back then,
are
yeah.
now 23 years ago, but they still should have seen something.
Yeah.
So,
So
I
you're like, "How do I feed
really
this baby?"
No, honestly, I was like, "No, I'm just gonna pretend like there's nothing wrong." And she was my best breastfeeder. She was amazing. And you know
Wow.
what I think about is if she was born in the hospital, she would have been sent to NICU for all kinds
Yeah,
of workup, right? And I mean, we worked her up and made sure there was no
of course.
syndromes or anything afterwards, but the good part was
You
I
just
had a fetal echocardiogram when I was pregnant
Mhm.
just to be sure because I was older. I
Yeah.
knew I was having a home birth and I wanted to be safe. I'm like, let's make sure there's nothing that we'd have to fix right away. Let's make sure everything works. So I
Mhm.
had a fetal echocardiogram. A lot of people don't know that that's an option instead of like the genetic testing because genetic testing back then was amnio. It wasn't like a blood
Yeah.
test like now.
Mhm.
I had that. So I knew her heart was okay because sometimes you think about the syndromes of the palate,
To
the
go along
heart,
with it.
all that and her kidneys and everything worked and she did great. She did great.
And
She was
so when you have a cleft palate or cleft lip, you just you have to compensate for it a lot with, like, getting a good positioning? Did you feel
so
like
she
you
her palate was okay. It was very
okay, just
high, but it wasn't open.
okay.
And the interesting thing was she did have a tongue tie, which I realize now, but I didn't then
Okay.
still, right? But because her lips were open,
Yeah.
she could get deeper, right? There was no
Good.
lip tie. There was no lip,
Yeah,
right?
there's no
So
connection.
she could get a really deep latch. So when I hear people whose babies are born with a cleft lip and they're scared out of breastfeeding, I'm like,
Like, just do
try it.
try
Because
it.
there was no pain. She
It
did
might be good. Yeah.
fantastic. She did fantastic, even with a pretty severe, tight posterior tongue tie.
Amazing. Did
I
she
never
have
had pain.
okay. And she breastfed and, did you end up having to do surgeries and stuff later?
Yeah,
Or
I had to
okay.
do surgery 3 months, and I insisted on being there as soon as she came out of the OR, and I put
Okay.
her on my breast, freaking everybody out in the recovery room. Because again, this is 23 years ago. Now
Yeah.
it might be accepted. They were like, "No, we have to take her vitals." I'm like, "Listen, if I unlatch her, she's gonna scream.
Yep.
So, do you want her to scream or do you wanna take her vitals while I'm nursing her?" Right? It was crazy. She was supposed to stay overnight, and they, like, discharged me in, like, 4 hours. They're like, "No, get the heck out of here."
Get this breastfeeding lady
Your
out of here.
liability.
And my surgeon was like, "I guess I'll let her feed." I'm like, "Let her?
Let
This
her
My
that's
goodness.
She got 1 dose of Tylenol, never she did not seem like she was in pain at all. I probably gave her
amazing.
some homeopathy without telling anybody. Because that was, back then you had to be really careful. But I just nursed her on demand and just loved her, and she healed beautifully.
Amazing. Oh my
Yeah,
gosh. What interesting journeys, like,
yeah,
all 3 of
right?
them.
And
And you're
so different, such different experiences.
oh my gosh. And I just wanna ask too about, like, your bottle feeding through with your first 2 kids and even with
Yeah,
the twins. Like, how did
yeah,
you handle just feeding all these babies? Like, how did
yeah,
you
yeah. So
with bottle feeding
I
too?
always felt that even though like I grew up in a bottle feeding culture, so I
Mhm.
had to learn about breastfeeding and attachment parenting.
Yes.
But what I realized the difference was like you can be a bottle feeder or you can be a nurturing bottle feeder. And in my generation, like I remember because I was the oldest of my siblings and my cousins. So I helped take care of a lot of babies. And
Mhm.
the theory that I was brought up with was stick that bottle in the baby's mouth, make them eat as much as possible, and then put them in the room and close the door. Like that's literally how I was
Yeah,
treated as a baby.
I
It's,
know.
I can go into my health problems because of it, but that's another story. So I always felt, even when I was bottle feeding, even as far back as my son, I never propped a bottle unless it was an emergency, even with the twins. Like
Yeah.
we had a lot of other kids, so I'd be like, "Hold this baby, hold that bottle." A lot of sitting on the bed with two of them with the bottles
Yeah.
and going back, I mean, knowing what I know now, I was still a fertile woman. I would have induced lactation for myself and given those babies some breast
Babies
milk. But
yeah.
I didn't know anything about that back then,
Yes.
or even some donor milk.
Yeah.
The twins are 26 now, they're very healthy. 27, actually, they just turned 27. They're very healthy. They
Amazing.
have some, asthma and, allergy stuff that's comes with being 30-week preemies and all that, but
Mhm.
but
Oh,
basically they're
healthy, thriving.
well-functioning human
Yes.
beings, and
All
they're
of it. Oh,
yeah, and they're
Wow.
sweethearts too. So, yeah,
wow.
so I always felt like babies should be nurtured when they were bottle fed. It shouldn't just be a method of getting the food in there. And it shouldn't be, instinctually I knew about baby led feeding. Like I
Yes.
never was one that said, here's the bottle, you got to get all this in them, you know?
Yes. Like you
So,
wanna look at their cues and still
yeah,
make it, like you said, a nurturing experience, even if
exactly.
no matter what method you're using, you're using it as a communication with
Right, right.
baby.
And
Yeah.
even back then, I was into, like, the wraps and things that I had weren't as nice as what, like, my daughter has for her
The
son,
baby
but
wearing.
I tried to wear my son because I knew he was happier when I was holding him, and I held him a lot. I was mad my son was so funny, he was independent from birth. He did not wanna lay in my bed. Like, he would sleep in his crib.
He
That
was
was what
ready
his
for
happy place. I had a blanket I had made for him that he still has. And he would
Oh,
say I would cover him with the blanket, and it almost was like he would go and yeah, we used blankets back then. Sorry, ladies.
it's
Sorry,
okay.
mamas of today. We covered
Yeah.
our babies with handmade crocheted blankets on their bellies, and he would go like, "Ah," and relax and just be so happy in his own crib. So, it
So
took
funny.
until my 3rd to get somebody that wanted to sleep in the bed with actually, my 2nd one, she would have stayed, like, up my butt forever. But my
Yeah.
my son was independent, so you gotta follow baby's leads too.
Yeah, and they're
Yeah.
also different. It's
Yeah.
I always like my son, my first is the one who's more very attached and I'm like
Mhm.
I mean they're both attached, but you know what I mean, like very
Yeah.
and I'm like
Clingy.
and I thought, as a first time mom I'm like, "Oh, it's me, I'm doing something wrong or it's because we had
No.
the NICU journey and all this stuff." And but now I'm like as having my daughter, I'm like, "Oh, this is just like your personality." Like this it just
Yeah,
is your
exactly.
temperament because my daughter's so chill. Like she's just like, "Bye, see you later." Like
Yeah, yeah, and
not
talk about NICU. I
mhm,
remember, again, this is going back 27 years ago. The twins were in NICU. They made record progress. They were
mhm,
30 weeks. Back
mhm,
then, 30 weeks was really
really
early,
early.
right?
Mhm,
Yeah. Yeah.
They wanted to send Alex home, the baby boy,
mhm.
at, like, 2 weeks. He didn't even need any breathing support, and
That's
my
perfect.
niece needed a little bit of CPAP the first day. So it was,
Mhm.
like,
Mhm.
miraculous how well they did, and they wanted to send him home right away, and I was like, "Wait, like, I have to get ready." I didn't know I was gonna be having babies coming back home to my house, so it was a whole scene, but the
Wow.
interesting thing about those babies coming home is they kind of just handed me the baby and said goodbye. I'm like,
Yeah, like
this
these are
baby's been having all this medical care. What do I
Yeah.
do with it? And they're like, "You've raised babies before." I'm like, "Yeah, but what's different?"
yeah,
Right.
yeah.
Well,
And how do I feed how much? Is there
And
anything
what do you wish you
special?
knew?
And
What do you feel like or do you feel like it worked fine, or do you feel like there is more you should have known about it?
I think that there should have been a little bit more of a gradual, like, not shut off the medical now it's a quote unquote normal baby.
Normal baby.
Like that's what it felt like to me. I hope things have changed since then,
Hmm.
but I'm
No,
not sure they
I
have.
think families still feel like that a little bit because that was actually the first podcast I ever did. I was a guest on someone else's and I
Mhm.
talked about like how going home from the NICU is like you shouldn't expect it to just even at 35 weeks or 38 weeks, like, but you were in the NICU and you were a preemie, like
Right.
there's still feeding issues that you're probably
Yeah.
working out at home and or
Yeah.
just considerations, even if they're doing great, like, let's consider that they might be really sleepy. We might have to wake them up
Yeah,
still, you know?
exactly. And then nobody talked to me like they were on monitors and now they weren't. Like, should I worry? Should I have a monitor? No, they're fine. Like, how do you know they're fine? And
Yeah.
then the other thing about that is volumes and how much holding they needed. And I feel from this is from my professional work now. When I
Mhm.
have a NICU baby, I feel like they need extra tender loving care. And I think there for some mamas and even dads, there's a fear of holding the baby too much. There's that fear of, that taking back of that baby as your own, whereas the baby seems like it's the
A
NICU's
hospital.
baby,
Yes.
you know?
And that changes, I think, the dynamic for the parent because,
Yeah.
like, I remember oh my god, well, I could do a whole podcast on this,
Yeah, I get it.
but yeah, like, I feel like you yeah, you really have every time I get a NICU baby, even a 37 weeker that didn't go to the NICU, but they're at home now, like, I'm working with one
Yeah.
right now, and I'm like, "You know what? Like, let's still just keep in mind that this baby could have just been passively being fed by a placenta for the last 3 more weeks." Like, and then when
Mhm.
we get to their due date, I'm like, "Hey, okay, it makes sense that now they're waking up a little bit more, and now you're not having to
Right.
wake them up for feeds." Like,
Right.
it we should give them extra care and, like,
Yeah.
think about adjusted ages and
Yeah. Plus also the trauma that so many NICU babies have had, like the things in their mouth, the
no.
positioning, being, some babies need to be restrained and IVs and all that stuff that's necessary, but a little bit cruel if you think
Yeah,
about it from that point of view. And now they're where? Like where are they taking up space? So they may need I'm not a fan of swaddling, but
yeah,
NICU babies might need a little bit more swaddling, definitely more skin to skin. And when we talk about my work with tongue-tied babies, I
mhm.
don't like I never like to
Releasing.
rush to release, but I
Yeah,
definitely don't like to rush to release babies who've been in the NICU because
totally.
I feel that they need to heal a little bit first and
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 there's
come
too
into
much
their own.
already negative oral experiences.
Exactly.
Like, I have a baby right now who definitely has a tongue and lip tie, but they were a 33-week preemie. They're about to have a
Mhm.
heart surgery. Like, I'm like, like, I'm not gonna push for a release right now
Right.
because we need to worry about just, like, getting off the tube first and, there's
Right.
a lot more going on.
Right. I mean,
Uh,
there are exceptions if it has to be, if there is
Mhm,
the baby's not eating at all or whatever. But always, I like to think about their body work. Like I love craniosacral therapy for babies and just settling their nervous system, whether they need some OT or PT or therapeutic tummy time, whatever methods are available and acceptable to that family, depending on their geographic or financial situation.
mhm.
Lots of loving, body work to make them integrate, become themselves with the mom.
Yeah,
I have somebody who does CST with the mom and baby together, which is just beautiful.
I love that. Oh my god.
Yeah.
so you talked a little bit about your work. I'd love to get a little bit more into that, how your feeding experience influenced your work, and yeah, tell us a little bit about what
Yes.
what your
Absolutely. So I can't separate my midwifery and my lactation because it kind of evolved together.
Mhm,
And, you heard me talk about my home birth. Doing the home birth was life changing for me in many ways because here I was stepping out of my comfort zone and standing up for myself in the face of my colleagues who some were very critical of me.
mhm.
So it
I
was a
was
big deal. It was a big deal.
I was gonna ask that was gonna be another follow-up. Did you experience a lot of pushback with
Yeah.
the home birth and the skin to skin being a labor and delivery nurse? So
Yes.
Mhm,
yeah.
Yes, absolutely. My friends were supportive and I had a few friends and most of them were at my birth, but
mhm.
there were people that I worked with that thought I was nuts. Literally, they told me, and I was, putting my life in danger. Don't you know all the things that could go wrong? What
Fear,
could
fear,
happen to
fear.
your baby? All that fear stuff. And I was like, I've had 2 normal spontaneous vaginal deliveries.
Yeah,
I'm a grown up. I am making an intelligent decision. I am taking responsibility for my actions. And honestly, being through what I had been through with my
the
sister and
separation.
her journey did empower me. Like, I was at a point where I was like, I've been through it. I can do anything now. And the same thing happened, it made me want to stand up for myself. I have the home birth. At the time
But
right.
you were
So
empowered because of your sister.
yes, I
Right.
was empowered from my sister. When I had my the home birth, I was already taking courses towards my midwifery degree. I had to get a bachelor's degree first, so I was in progress. I was almost ready to graduate for that. So I took that energy of having, rocked my home birth and standing up to everyone, and
Yes.
my friends who were midwives encouraged me, and I said, I'm gonna do this. Now, I still was nowhere near where I just thought I wanted to catch babies because I'm like, I'm a labor and delivery nurse. I'm a damn good one. And the doctor's coming in at the last second and getting all the credit. Like, it was like, I could do what I just
Like,
have to
I can
learn.
do
I
that.
just have to get the license. I was even
So
catching babies. You know what
true.
I mean? It
Yeah,
was
if they didn't
crazy.
get there in time or whatever.
Right. So, I was in school, empowered by my birth. I had to do a senior project and a research project, and I decided that it would be in lactation because at that same point at the hospital they were pushing research, so they had a research committee, and my friend and I joined it, and that's where the Skin to Skin project grew from. Now, at the same time, the same year that I was graduating, New York City, well, I was in New York. I'm in New Jersey now, but I was in New York City. If you know anything about geography, I was in Staten Island, and Staten Island is kind of like the forgotten borough of New York City. So
Uh-huh.
we paid all the same taxes, but all the good stuff went elsewhere, right?
Okay.
No private hospital. So New York City has the breastfeeding initiative. It was like nationally known. Mayor Bloomberg was giving all this money to the city hospitals to support
Great.
breastfeeding, support baby friendly initiative, and all that. But we were on Staten Island. We were getting nothing because we were a private hospital. So my friend and I started pushing back, writing letters. We made like a campaign. We forgot to
Amazing.
tell the administrators at the hospital. We get called into a meeting saying, you should have let us know you were doing this because now there's a news article about you. It was
Oh my
so funny.
gosh.
I was like, oh no, am I going to get fired? No, you're not going to get fired. They want to give us a grant. If we get the grant, if you
Amazing.
write the grant, now I'm a grant writer, right?
I regret right.
If you write the grant and your job description, you can have the job of breastfeeding initiative coordinator.
Wow.
So I'm
Amazing.
like, okay, because nobody else knew anything about breastfeeding. Like,
Right.
I wasn't a lactation consultant.
Oh my
Right.
God.
So here I am. Okay. I become the lactation coordinator. I'm half my time. Now I'm like, all right, I better become an IBCLC. So I started taking that path right after I graduated, or even before I graduated with my midwifery license. Half of my life I was wearing a white coat with a name tag and I had to dress up, and I was an administrator. And the other
Okay.
half I was working as a midwife catching babies. It was insane. And then I would be like on call, and it was just crazy. But anyway, it was fun. It was very fun, but it was a little crazy. So I became an IBCLC
Mm-hmm.
and did all that stuff. Knocked my head against the wall for 8 years trying to get baby friendly at this hospital, and nobody wanted. Like, I had all these ideas and responsibilities, but no authority.
Yeah. Yeah.
So it was very
So
frustrating.
hard working within systems for these things.
Yeah. And I was working with a
And
lot of
culture.
people. There they are with the arms folded again. The nurses like, yeah, sure, you're going to change us. We've been doing this for this many years, and that
Right.
kind of thing. I had doctors that refused to see babies in rooms with the parents. I mean, I, the whole thing with the formula, buying formula, that was like insanity. I got written up in a newspaper article like I was being a Nazi for formula. Like it was insane. It was insane. Like
certain formulas you were.
In other words, there was a point where to become baby friendly, you can't just freely give out free formula. But you would think like I was depriving children of their nutrition the way they
like
made it.
there wasn't an alternative.
There wasn't an option for
So that's another story. But what happened eventually?
Polarized. We've talked about that on the podcast before.
Yeah. We could do a whole series on that.
We'll have to, maybe we'll have to have you back on. We definitely do.
There's so many questions.
Yeah, and then this is fun because I talk about tongue tie on my podcast. I don't get to talk about all this fun
all
stuff.
the other stuff. Yeah.
So what happened was at the same time, now this is going back 10 years ago, well, probably 12 years ago, I started to see babies that were tongue tied. And anybody who had any problem breastfeeding, I was the one that was called, right? Because it was myself and my friend who worked on the evening shift. I worked days, she worked evenings. So we were known as the breastfeeding people, whether or not we had our IBCLC. So we got our IBCLC, went through all that. And I started to, even in my office hours, people were sending me mamas and babies who were struggling with breastfeeding. And I started to see more and more babies that I couldn't help with all the tricks and tools that I knew. And I was hearing about tongue tie. But, as a midwife, I'm basically non-interventional, right? I don't want to do anything. Right. I don't want to do anything that doesn't have to be done. And my instinct was telling me there shouldn't have to be an operation for a baby to have to be able to breastfeed. So I was very resistant. So I am that person who I'm now trying to convince, I was that person. And then I had 1 week where I had 3 babies come to me that I could not get to latch. And I could get anybody to latch, even in the office. I could do it. And I couldn't get these babies to feed. And one of them came in the beginning of the week, came back at the end of the week, and had a tongue tie release by an ENT with a scissor in Brooklyn. This guy that started doing and this baby was now nursing. So I asked her all about it. And I was like, I'm not ashamed to learn from my patients. I never have been. That's some of the best lessons we learn is from the families that we care for, right? And then I went home and I did the research and I Googled and I found organizations and I found conferences and I found who was doing it and who, and I just deep dove into it. And then I became known because I knew more than anybody else knew.
Yep.
I made relationships. I networked with people. Yes. I was fortunate enough to make networking relationship with Dr. Scott Siegel. Okay. And we started working back and forth, referring to each other. He gave me mentorship and confidence that I never would have gotten anywhere else. Kathy Watson Jenna also. I mean, wow. I am so lucky because I have these people. These are the pioneers. These are, the goats, if you
the goats of the field.
Yeah. And the kindest people in the world, and I spent a lot of time in Scott's office. I spent time in other people's offices. I went, like I said, I went to conferences and I just started talking about it, lecturing about it, and more and more people were sending their people to me, other lactation consultants, anybody who was having trouble that they couldn't help, they came to me. So I became known as the tongue tie expert, even though I was like, how did I get this title?
How did I get it? This is the long journey. Well, I love just hearing about your parenting journey and your career journey. I just feel like you seem like such a passionate, go-getter. You just, everything that you started learning about, then you just went further and further, and it's led you on such a cool path.
Yeah, definitely a lifetime learner. I love to learn.
Yes.
Yeah, the intertwining between the two of your own feeding journeys and then your professional journey and working with patients, they just informed each other.
Yeah, isn't that a woman-centered response though? we
Yes.
shouldn't, like, back in the day, it was all about what you learned in school, and you were
Mm-hmm.
supposed to keep your personal life separate. And
Mm-hmm.
how can we? Right?
You really
How can
can't.
we?
I know that Ellen Pompeo interview like recently like went viral, and I'm like, it's so good how she talks about motherhood, how like it does change you, but it changes
Yeah.
you like in the best way. And like a lot
Yes.
of it, so many people who find themselves in the IBCLC world or just in the tongue tie world, especially like airway
Mhm.
world, it's always like, oh, my kid had it, you know? And
Mhm.
I mean, I just think it's when I've learned so much more from my own personal feeding journeys than I
Mhm.
have from, I mean, I've learned it from the conferences and the mentorship and the hospital and
Yeah.
everything too, and jobs. But I feel like when you do it yourself, you just have a different perspective. And
Yeah.
yeah,
Yeah.
Yeah.
yeah,
And we are whole people, you know? So like
Mhm.
I want my professional life to inform my personal life and vice versa. You know, I don't have the capacity to like compartmentalize in that way, especially
Mhm.
if one can enrich the other. So
yes,
yeah, that's kind of like
And that's how it should be. As
yeah.
you
yeah.
said, we're whole people, you know?
Mm-hmm.
We're kind of lucky
So
to be in this field that like lends itself so well to that too.
Yeah.
yeah, it's so true.
Hmm.
We always like to ask
Hmm.
before we ask where people can find you. So and you probably do this in your course in your podcast, but say you see a mom and she's at the beginning of her feeding journey and she's struggling, what advice would you give her? Say she just had a baby.
Yeah. So the most important advice I think we can give is to follow your instincts. If you feel like something is wrong, then something you need help, right? Don't be gaslit by people saying, "Oh, it's fine. Oh, it should hurt. Oh, it's always hard in the beginning." Not necessarily true, right? And the second thing I would say is to reach out for help. And, if it's a breastfeeding issue, an IBCLC if possible, an SLP with feeding knowledge, I love to network and manage with SLPs because there's things that SLPs are better at than I am as an IBCLC. But not to ignore the maternal aspect of it. So somebody who's just a feeding therapist might not know the maternal side of things. So I like, definitely, especially early on, a mom needs a lactation consultant to get that area. If not to give up, not to be gaslit, not to take the immediate answer from your pediatrician who probably doesn't know anything about managing breastfeeding. They
Hmm.
may know that breast is a good idea and they want you to breastfeed for all the benefits it gives the baby, but they have not been taught how to manage your discomforts or your challenges. So not to disparage any pediatricians. There are some
No,
who have
but it's
taken other courses, but that's not the
But it's
person.
like that's why there's a separate role, and that's why, as you
Exactly.
always hear, usually people have these long journeys of education to get
Mhm.
to the point where they are an IBCLC. So
Exactly,
yeah,
exactly. And, we don't learn about this in school. I did not learn about breastfeeding, as you heard me say, as an RN, as a midwife even, and as a lactation consultant, I got very little training in tongue tie.
hmm,
So,
it's
yeah,
people that seek out this information
yeah,
to
yeah, it
find the
is.
right people.
Exactly. So
Yeah.
that's what I would say.
Hmm.
If you are a professional, I would say be open to the fact of lifetime learning and realize that you didn't learn. Like the most important thing we could do as professionals is
One.
to understand what we don't know.
Mhm.
Because that was, I think back to that me in that office 12 years ago, and I could have just said, there's no such thing. I've never learned about it, and
Right.
let these women go on their way. And I wouldn't be where I am today. And I wouldn't have helped thousands of
Yes,
families,
literally.
Yeah.
Yeah.
So be open to learning, realize we don't know, realize that knowledge is evolving,
Yes.
like, I mean,
Research. These are
so
newer.
much.
Yeah, some parts of the field are newer, and there's going to be more and more research. But
Yeah. I
we're
mean,
doing the work right now with our
even
patients.
my own professional course that I first recorded 3 years ago, I just redid because things had changed in what I recommend for management based on new studies, new practices, our own clinical experience. So yeah, so always update and learn.
So
Awesome.
can you tell us more about how people can learn from you now
Yes,
or visit
absolutely.
you if you still see clients at all? Or
Yeah, most of my work is virtual right now, but if you're local, I could probably find a place to see you. I recently moved and my clinical space is not here anymore, but I could share people's offices. But I'm
Yes.
doing mostly virtual. I teach. I have the Tongue Tie Experts podcast. You can find that on every podcast. I have a lot of really good stories of parents too, different professionals I have interviewed and parents. And then some of them is just me chatting. Most of those are recordings that I do every Tuesday on Instagram on Tongue Tie Experts. I do
Nice.
Tongue Tie Tuesday. So you can
Okay.
come on and ask me questions or just
Nice.
laugh at me. No. It's a very casual, sometimes I have my dog on my lap,
Oh,
very
I love
casual experience. And then my website is tonguetieexperts.net. Somebody had already taken .com, so it's
Okay.
.net. And I have courses for parents and professionals. I have a great course. I know you probably have a lot of SLP followers, and I have a great course about milk supply for medical
Oh,
professionals. It's a very, it's a short course. It has all the important things that you'd want to know if you didn't learn about how to support mom's milk supply. So that's on the website. Tongue tie. I mean, the professional's guide to tongue tie in the breastfeeding infant is the crown jewel of what I offer. I have educational resources. You can actually buy a packet of educational things to give to your parents, so you don't have to make the handouts. I already did that for you.
Amazing.
And I have a membership where we have monthly meetings, and we have only exclusively for the membership. We have a group that we can post cases in, and every month I have a meeting where we chat on and off recording, so we could talk about things we don't want anybody to know about. And then we record the presentation. I have special guests and stuff. It's fun.
Amazing. Oh my gosh. You are such a amazing person in our field, and we're so grateful that we had the chance to talk to you today. This has been an awesome conversation.
And you are both doing amazing work in your own right. And I congratulate you on your new podcast. This is wonderful.
Thank you. And we never got to your grandson's journey.
I think that'll be next time.
We'll do another.
I'm about to have a granddaughter.
Oh, let's do a grandkid episode.
Yes.
After that journey.
Amazing.
All right, sounds good.
Okay.
Thank you so much, Lisa, for coming on.
Bye-bye.
Okay, bye. Thank you guys so much for listening. If you are interested in learning more about attachment feeding or have any feedback for us at all, please email us at thefeedinghourpodcast@gmail.com. You can also sign up for our email list in the link in the show notes to be the first to know when a new episode is released. See you next time, and happy feeding.